Take menopause as your N of 1 experiment to make yourself a better person. We have a chance to improve our health, to improve our lives, to protect our future selves. Why not use this time now to do it? And of course, go and seek medical advice from a proper medical professional. Go and find the menopause doctor. I have, again, in my freebies, how to find a menopause doctor. There's so many out there. I know it feels like there are none, but there are, and they want to help you, and they're getting more and more experienced, more and more trained. So please don't hesitate to reach out to a doctor who is well-trained in menopause. If you need help with that, you just reach out. Welcome to another episode of the Hack My Age podcast. Today, we are going to cover some basics, but we're also going to probably mention a few things you didn't really know. So hang in there, because we're going to start off with what is menopause, but what are the different stages of menopause? There's early, mid, and late perimenopause. Then there's a couple of stages post-menopause that you may not know about. And we're going to cover some of the common symptoms, which you may already know about, but some of the uncommon signs and symptoms of menopause that no one ever seems to be making these connections. And then we're going to mention the silent killers that you may be unaware of for those women who are asymptomatic, who are like, yeah, I'm just sailing through it, but there's things you need to know about this. And before we dive in, I just want to remind you for the Biohacking Menopause membership group, this is a women's only support group for menopause. We have a giveaway every month, and you've got to jump in this month before March 1st, because we have a Flex Beam. It is a red light therapy device. It's like $600. It's a gem of a device. I use mine every single day. There's so many uses you can have for this, and I highly recommend you jump in. But also, if you're post March 1st, 2025, then you can just go and get your own. I have a link to that in the show notes. Now, jumping right into our episode, don't fret if you feel like you're the only one who doesn't know about menopause. Most of us don't know much about menopause, even when we're in our 40s and 50s. And there was a study that was published in Post-Reproductive Health. They looked at data from 829 post-menopausal women, and they did an online survey. This is 2021, it's a while back, but they found that 49% of the women did not feel informed about menopause. Now, remember, this is a social media study, so the number is likely higher, because if you're on social media, you're probably getting a lot of menopause news, right? I think, unfortunately, our doctors are not giving us enough, so we kind of seek other sources. That's why you're here, right? And then from this study as well, more than 90% of postmenopausal women were never taught about the menopause at school, right? I would make that number 99.9. I didn't talk about menopause in school. I don't know what school does that, but they did. That's a pretty amazing school. And over 60% only started looking for information about it once their symptoms had started. So that's why I'm always worried about the asymptomatical women, because she is not looking for information. She feels fine. And there's things that are happening under the hood that we just need to be aware of. So there is this huge gap in understanding menopause, and the information on the treatments is conflicting and confusing. And it's going to be like that for a while. So if you're in doubt, you may be having some symptoms, you're not sure, am I in menopause? Is it aging? Is this normal? Or is this some other kind of disease? Well, then when in doubt, go check with your doctor for sure. But if you are suspecting you may be in perimenopause, well, then let's dive in deeper. We're going to start with perimenopause, because perimenopause can last a year, can last 10 years, could even be longer for some. So we need to break this up in different stages. We have the early, the middle, and the late perimenopausal stages. And some women, just to keep you informed, some women, again, feel no symptoms at all. They just skip right into menopause without any obvious symptoms. But when we cover the symptoms later on, you might go and have an aha moment. Ah, that was menopause. So early perimenopause This is the early stage. It doesn't mean you're having it earlier than everyone else. It's just the first signs and symptoms of perimenopause start around mid to late 30s, early 40s. You are starting to notice some changes. And usually it's in your periods. They may be shorter, they may be lighter. They're just different. You have an inkling that something's off. Maybe you were a 28-day girl doing her like a spot on every 20 days, get your period, and then suddenly it's 26 or 25. You also may start noticing sleep changes. And this happened for me like about 43. That's when I started to wake up to pee. I'm like, what? I never did this before. And this is just a sign that my progesterone was taking a dive. Progesterone takes a real steep and fast decline in your mid 30s. And it's much faster than estrogen, even though without the estrogen, sometimes we feel like we're falling off a cliff. But when you're in your 30s or even early 40s, you are not thinking about menopause. I certainly was not. So I had no clue. So something's off, something's little different with your sleep. Once in a while, waking up is fine. But when you see this happening night after night, suspect that perhaps progesterone is heading out the door. Maybe you notice a little change in your weight. You say, well, I don't know, nothing's changed with my diet and exercise. I don't know what's going on. It's sort of that unexplained weight gain starting to creep up on you. And then you may notice your skin is a little bit more dry, your hair is getting a little thin. These are all signs that perhaps it's perimenopause. And if you go to get a blood test, you may find that your progesterone, for example, if you look at that, it could be okay or it could be lower than normal. I strongly recommend women of all ages to test their hormones, especially when you're younger, when everything's fluctuating normally. When you have a normal cycle, it's wonderful to see what's normal for you. And then as you start to have some symptoms, then you can check and go, I see. For me, it's a little low or a little high. Next, we're going to go on to the mid perimenopause. Okay. This is when you are seeing a few more signs and symptoms. It's happening probably around your mid 40s, more or less. And your periods change again. You may be skipping a period. Maybe you're going longer. Maybe before you were 28 days and now you're 30, or maybe you were 25 and now you're 28. And maybe they're even a little heavier. Something is off. You know it because usually we're quite regular with our periods and something's not going right. You may even notice that you get a couple of periods in the same month. And that's weird. And that can be a little panicky because you go, well, why am I bleeding early? Because anytime you see blood coming out of you, you tend to worry. So if you think it's something else, obviously go to your doctor. But it can be a sign of perimenopause, that mid stage. Hormones are really going a little wonky now. This is when you start to really losing the progesterone. The estrogen is starting to head out the door. You may or may not be ovulating. I don't know. You can check always with one of those ovulation kits. And this is the time where some women may feel a hot flash or a night sweat. And you wake up and you're hot and you're like, why am I hot and no one else is? Or you're just kicking off the sheets. You don't need to be in a drenching sweat to know that your estrogen is going out the door. You can have a racing mind. Suddenly you're waking up at 2 a.m. and you've got these thoughts in your head. They just don't shut up. So again, a sign of perimenopause, that middle stage. And if you are suspecting that your progesterone is going out the door, then you may want to start a progesterone cream, something very simple, topical. You can get these online. I love Karen Martell's progesterone. I've been using it. It's got great ingredients in it. You can get it online. You don't need a prescription. And that may help you to sleep better. It may help you with those racing thoughts at night. And as we go through this middle stage of perimenopause, we start to have more fluctuations with estrogen as well. Estrogen can be estrogen dominant, can be a lack of estrogen. It's can both have the signs of breast tenderness or other types of symptoms. And maybe your periods are getting a little heavier at this stage. And you may also want to take a look at this point at your FSH. That's your follicle stimulating hormone. And this, it may be going, maybe you're probably likely very low when you're pre-menopause, and you may start seeing them increasing from 8 to 9 to 10, 12, 16. It's getting into these double digits, and it keeps on rising as we get towards menopause. So when you're hitting the menopause stage, you're pretty much likely going over 20, 30, can get higher and higher. So this is your follicle stimulating hormone is this communication highway between your brain and your ovaries. And what your brain is trying to do is tell the follicles that have the eggs to do their thing, and wants your ovaries to make more estrogen. It's like, why isn't there any more estrogen going? We need a little bit more. So it's trying to send that signal. That's why the FSH increases. And it wants you to ovulate month after month, but your ovaries are starting to shut down. And as they shut down, FSH just gets louder and louder and louder, and that number gets higher and higher. So generally, a lot of functional medicine doctors like to get you under 10 when you're in this perimenopause phase, as well as other doctors as well. Even when you're in the menopause phase, I've heard under 20, I've heard under 10. Dr. Lindsay Berkson, who's in her 70s now, she's like 5. And so we do this through estrogen therapy, bioidentical hormones, and you can help get that lower. And then we have the late perimenopause stage. That this is when you are getting more close to menopause, which I will explain exactly what menopause is. And it happens around your late 40s, even early 50s. I am a very late perimenopause at 54. And actually, it's the first time in my life where I've gone 3 or 4, I think it's 3 months in a row without a period. And I also had 2 hip surgeries, and hip surgeries coincided with that. I got 1 period in between 3 months, and then I'm still waiting for my period to come, and it's like day 35. So I am in that late perimenopause phase, and I'm also in a bit of a later menopause than usual. So at this stage, you're probably skipping cycles more frequently, like me, and maybe they're gone for periods gone 3, 4, 5, 6 months, and then another period comes, and just sometimes it can go away all in one go too. I've talked to many women who said, I don't know, I just had my last period and never came back. There was never that fluctuation. So anything goes here. There's no one size fits all or one diagnosis for everybody. So these are basically symptoms of low estrogen. When you start to lose your estrogen, your periods go away. And then also we have low progesterone as well. So at this point, you may be feeling tender breasts because, again, your hormones are fluctuating. And especially if you are taking hormone therapy while you are still in this perimenopause phase, your body's still sometimes spurting out a higher estrogen level. So you're kind of topping things up. So you may go, oh gosh, I found my perfect dose. And then boom, oof, breasts are really tender. What's going on? Or even hot flashes come back. Hot flashes can be a sign of too much estrogen. It can be a sign of too little estrogen. At this point, maybe you're feeling a little bit of brain fog, drier skin, hair, nails, eyes, vagina. Everything seems to be drying out. Joint pain is another very interesting symptom that a lot of people don't really consider, don't make that connection with menopause, but it really is something I've seen so often. Mood changes, right? You're not quite yourself anymore. Thinning hair. Sleep is again getting worse and worse. And that weight gain. You probably at this point, if you've been struggling with your weight, you've been trying a lot of things and you just don't know. Sometimes you're eating a little too little and training a little too hard, and then you're gaining even more weight. And then you may, if you are testing your cholesterol, your thyroid, triglycerides, these also start to go off. And again, not every woman but it is a common thing that happens. So at this point, I would really be tracking your symptoms so that when you go to a menopause doctor, hopefully a menopause doctor is trained in menopause medicine, you can explain what's going on and they can help treat you based on your symptoms as well. And at this point, you really may want to consider bioidentical hormone therapy in addition to an obviously healthy diet and lifestyle, because that helps so much. And it's at this point, if you are testing your blood, it's really hard because you may have high estrogen in the morning and then low in the evening, or vice versa. One day to the next, it changes. And I understand why doctors don't want to be testing at this point. I still am interested. I like to know. So I'm one of these people who I understand that it can fluctuate. And I always take that into consideration when I do talk to my doctor about my hormones, in whether it's through blood work. And you can also do a urine test, 24-hour urine test, or a Dutch test, which is a dried urine test of comprehensive hormones. This is a really interesting time to be watching those hormones fluctuate up and down. But at this point, if you are feeling the symptoms, you really, really want to treat those symptoms. You just want to feel better because you may be, quote unquote, in the range during your blood test, but you still feel like garbage. And your doctor may go, no, your hormones look fine, but you're feeling horrible. So really, symptoms are really first at this point. And then another thing that's really interesting in this late perimenopause phase is that once you skip your period for 3 months, there you have a higher chance of being in menopause within 4 years. It's just what the research has been showing now, and could change. I don't know, but that's sort of a interesting fact. So, what is menopause? Menopause is a one-day event. Really, it's funny because we use this word menopause, and it's an umbrella term for the perimenopause and the post-menopause phase. So often I use it interchangeably. I'm menopausal, I'm perimenopausal, but really when you say menopause, medically speaking, it just means that we have 12 consecutive months without a period. Yeah, your periods are gone and they're not coming back unless you do hormone therapy. If you take high enough dosages, you can make it come back. You're not ovulating, but you'll have a bleed, a fake bleed. But generally speaking, your ovaries are no longer releasing eggs. You start to produce less and less estrogen, progesterone, testosterone until it's about 90% gone, more or less. And it's just a sign. It's the end of our reproductive years. And a lot of women have trouble with this. We don't feel youthful anymore. And I think it's really something we need to shift our perspective a little bit. And it could be a great thing to end our reproductive years. Some women are happy about it, some women not. But menopause really is so much more than just losing our hormones and these medical terms. It's a rebirth. It's a transformation. It's an opportunity to transition into our best selves. It's a time of empowerment, wisdom, experimentation, and learning more about ourselves physically, mentally, emotionally, even spiritually, if we choose, because menopause is inevitable, but suffering is optional. Right? So we can do so much around this change. We have options now that perhaps our mothers or grandmothers didn't have. So really take control of your menopause if you want. Now, menopause, that sort of 12 consecutive months without your period, it happens somewhere between the ages of 45 and 55. And this is the Western world. And the median age is 51. I've heard 50, I've heard 52, whatever. In the US, it's about 51. In Asia and Africa, it's younger, it's 48. In Latin America and the Middle East, it's 47. So again, these are just median ages that can happen. The range is so wide. So if you're like 48 and you go into menopause, you may think, oh my God, this is so early, because your brain is thinking menopause is for after 50. But not so. Then we have different types of menopause. We have early menopause, premature menopause, and late onset menopause. The early menopause means that you're hitting that 12 consecutive months without your period at about 40 to 45 years old. Because if, we generally say it happens between 45 and 55, anything under 45 is a little early. Now, early menopause, the reasons why we have an early menopause, well, it could be anything from our genetics. It could be because smokers tend to have a little bit earlier menopause. If you've gone through surgery, there's surgical menopause. When you remove your ovaries, you move your uterus with a hysterectomy. But when you remove your ovaries, you pretty much skip most of perimenopause and you go in this to menopause transition, you go straight into menopause. It's quite a shocker. And I met many women who didn't know this was going to happen. They weren't warned by their doctors or supported. So yeah, you're not alone in this if you're feeling it. And then there's also cancer treatments or radiation therapy. All these things can set you into an early menopause. Then there's the premature menopause. Again, we're not talking about perimenopause. We're talking about if your period stops in your 30s and 40s. And that's premature. It's different than saying early. And that's about 1% of the population. There are not that many women going through menopause between the 30s and 40s. And then there's late onset menopause, which is the other end of the spectrum. And that means if by 55 or older, you still have your period, then it's pretty late. So basically, after 12 consecutive months without a menstrual period, a woman is considered to have reached menopause. And you may have, again, at this stage, around this age, whatever it is, even more signs of menopause, maybe even more intense hot flashes or more frequent night wakenings or worse sleep, more weight gain, or maybe none at all. The spectrum is so wide. I think it's about 25% of the women are asymptomatic, like just don't feel anything at all. And this is a time where your FSH is probably going above 20. Some say above 40. You can always check your FSH. You can check it several times just to see what that number is. And if you are interested in protecting your brain, or at least lowering the risk of dementia, of lowering the risk of other diseases of aging, then we need to get that FSH below 20. And that's a whole other podcast episode. Now what happens post-menopause, right? There's two different stages that I could find, and I have a feeling there should be 3 or 4 maybe, because when we're post-menopausal, if the average age is 51, well, I personally think menopause can be very different when you're in your 50s versus your 60s, 70s, 80s, and 90s, right? All of these women are in menopause in these ages. So I think there's got to be some new research or new terminology coming up. So stay tuned. So this is when post-menopause, generally speaking, women tend to stabilize, right? Our hormones are maybe gone completely unless you're using hormone therapy. And that's when they sort of even out because they're all pretty much hitting rock bottom. But women's health, all of these changes that are happening, they continue to change through our 50s, 60s, 70s, and 80s, right? And this is due to the loss of hormones. Sometimes it's due to aging, of course, genetics, many other reasons why we get to these diseases of aging. But when we lose our hormones, it's a big contributing factor. And again, our health in our 50s may be completely different than our health in our 90s. So again, we just need more terminology here. So we have in post-menopause, there's early post-menopause and there's late post-menopause. And early post-menopause is about 2 years after your final menstrual period. And so if you're got menopause at age 50, then up until 52, you're in early post-menopause. And so your body's still transitioning, but it's getting more and more stable. And you continue to have those FSH levels increase. You continue to have decreases in your testosterone, estradiol, in your progesterone. But by the end of this stage, levels really tend to even out. And after that, we have late post-menopause, which begins around 3 to 6 years after the final period. And that's when you really have stabilized. You should be stabilized, and you have a decreased risk of menopause-related symptoms. Again, we're talking about symptoms here because you have an increased risk of age-related health conditions like osteoporosis and heart disease, all because of your the loss of the hormones. So you may be feeling better, which is great, but again, we got to look under the hood. And I've met plenty of women in their 60s, even 70s, who are still having menopausal symptoms. And there was a study that was done on women over the age of 60, and 41% of them reported moderate to severe menopausal symptoms. That's just one study. There's, again, you can find lots of studies out there, but if you are still feeling symptoms in your 60s and 70s, you can do something about it. You don't need to suffer. And I personally believe once we hit this stage, perimenopause, menopause, post-menopause, we need to work a little harder. It's not as easy to build muscle. It's not as easy to manage our diet. We can't eat anything like we used to. We have to step up our game if we want to protect our future selves. And this is, again, up to you. If you don't want to, that's absolutely your right to do whatever you want. But my objective as a gerontologist is always to look after my future self. How am I going to be when I'm in 70s and 80s? I want to be independent. I don't want to be a burden on my family. I want to be strong. I want to be able to do the things that I want to do. I understand that perhaps there can be some adaptations. I'm not 20 anymore, but I want to be able to really, really be the best version of myself. And that just means I got to work a little harder, unfortunately. That's the way it is. Let's talk about symptoms. There are 103 symptoms of menopause. Did you know that? We usually think about 8. And when you go to wearemorphous.com, Andrea Donsky, she has a great list of all 103 with explanations. And I find it really great. I'll have a link to that in the show notes. So when you're feeling these symptoms, and I'm going to list them, you may go, is it aging? Is it menopause? Is it something else? It could be anything, honestly. I'm not saying everything's due to your hormones. Everything's due to menopause. Always check your doctor when you're in doubt. So some of the common symptoms that we're seeing in perimenopause, and we can see postmenopause, are often due, obviously, to high or low estrogen, progesterone, or testosterone, and so some imbalance with them as well. So it's not like, oh, my estrogen is too high. It could be just that your progesterone's too low. Who knows? So I have a great symptom chart on my Facebook group, Biohacking Menopause, where you can see when your estrogen is too high, you'll have these symptoms. When it's too low, you'll have these symptoms. And if you can't find that list, just contact me. I'm on social media, hackmyage or hackmyage.com. Send me an email, whatever it is, and I will send you that symptom chart. It's so useful. You should have that like plastered on your fridge. So the common symptoms most people associate with menopause are hot flashes and night sweats, right? This is pretty much all I knew when I was obviously going through early perimenopause in my 40s. But it happens to about 75 to 85% of the women having these things. And again, when we say hot flashes and night sweats, not always we're having this like steaming, hot, horrible experience or at night drenched in sweat. It could just be, I'm a little hot, or you see yourself kicking off the sheets a little frequently when no one else is. That's one of the most common signs that everybody's looking for. But I think it was Andrea Donsky, through her survey, thousands of women, she found the most common one was fatigue. Right. And again, that can be blamed on aging so often, and it may not be aging. It may just be hormones. Irregular periods is another obvious one. And the mood changes may have a bit more anxious, or if you've had anxiety, depression, maybe it'll come back. Maybe you're feeling just more intense feelings. If you may feel that, oh gosh, I'm not as resilient as I used to be. When something bad happened, you managed it pretty well, and now you find it just harder. You may be more irritable, less patient. Sleep, obviously, that's very often just starts with sleep disturbances, vaginal dryness, decreased libido, memory problems, difficulty concentrating on things. No, you may not be getting Alzheimer's. It could be the hormones. But there's so many great tests that we can be doing throughout our lives to test our brains in order to see, are we heading towards dementia? And then we have so many solutions. Breast soreness, another typical one. Although I do find a lot of women not knowing that, actually, that breast tenderness is a common sign of menopause. Itchy skin, right? Because when you lose your estrogen, everything dries up, your hair, your skin, your vagina, and then you start to feel itchy. Thinning hair, brittle nails. Sometimes this has to do with thyroid as well. It's not only your sex hormones. Bladder issues, incontinence, frequent urination, the dry eyes, watery eyes. And then the less common symptoms that I find also women not really making that association with is joint pain, although that's getting a bigger chunk of the media. And I think Dr. Vonda Wright is doing a lot of help through this, making women aware of the symptoms of joint pain as menopause. We have more digestive issues, bloating, gassiness, maybe more allergies than we used to have. Body odor can change. Notice that? Yeah. Your heart palpitations, chest pain. I think Oprah made a lot of headlines with her story, how she went to the cardiologist and freaking out that she's having a heart attack when in fact it was just menopause. Breast or nipple tenderness, changes in libido, dizziness, vertigo, increased facial hair or loss of body hair, right? These two things that we can be seeing. Ringing ears, itchy ears, phantom smells. This one, I did a great podcast with Andrea Donsky on this one, where she explained phantom smells are things that where you say, let's say you smell smoke and no one else does. And it could be gasoline, it could be even something like chocolate chip cookies, something nice, but most of the time it seems to be something not so pleasant. Muscle weakness, muscle cramps, vaginal prolapse, atrophy, bladder infections, frequent UTIs, incontinence, headaches, migraines, pelvic cramps, loss of motivation. That has a lot to do with testosterone going out the door. Increased aggressiveness, probably too much testosterone if you're on that. Burning tongue, bleeding gums, frequent injuries, restless leg, dry mouth, easy bruising. Any of those new to you? You may want to look into your hormones and see if this is menopause related. It may not be, right? Joint pain, believe me, I had major joint pain. I tried the hormones. I tried to get onto hormone therapy, and either I was too late, baby doses, I don't know, but it was clearly osteoarthritis and mechanical. So I'm not saying it's always hormones, but it's a good place to start is looking at your hormones. So silent symptoms, right? We want to be aware of osteoporosis, heart disease, hypertension. These are the silent killers. We don't maybe have no symptoms at all. Oh, maybe we have all of them, but we're not feeling our bones getting brittle. We don't feel our arteries getting clogged. We don't feel so much a stroke or a heart attack coming on until it happens. Right? We need to look under the hood a little bit more when we're testing hormones. When I say testing hormones, I'm not talking about estrogen, progesterone, testosterone. Of course you can, but I'm looking at your bone density. Get a bone density scan. There's the DEXA scan or the REM scan, which I think is superior, REMS, because it looks at your bone strength. You may have less dense bones, but it doesn't matter if you have strong bones, if they are good quality bones. It's really important. I have a great podcast that we did all about this. Put that one in the link in the show notes. And so all of this, when you are losing your estrogen, you're at increased risk of osteoporosis. This is why across the board, menopause societies across the world are approving estrogen therapy for osteoporosis. Okay. And obviously, if you are taking estrogen, you need to take the progesterone as well. And yeah, so oftentimes you don't really know your bones are getting brittle until you get a fracture. And you may not be seeing this in your 50s, but it may happen more in your 60s and 70s. And I'm sure you've heard the stats, people over the age of 65, when they have a fracture, a fall, they have a 20 to 30% increased risk of dying within a year. It's a pretty mega statistic. And if you know anyone that in your family or people, friends who had a fracture, you can see them going downhill when they're a bit older because the quality of life changes. They may not recuperate the same, or maybe they've got an operation to fix the fracture and they get an infection in the hospital. There's many reasons why people are dying. It's not you just die. So the stats are pretty impressive, and I've heard anywhere between 20 and 30%. Heart disease as well, number one killer of men and women. So why aren't we paying more attention to our hearts? We give a lot of attention to cancer or breast cancer, which, needs to be. But for some reason, heart disease doesn't get as much airtime. And I think we really need to understand that we have an increased risk of heart disease within 5 years of menopause, all due to the loss of our hormones. And there are other hormones at play here too. Cholesterol tends to go up. Thyroid tends to go a little wonky. Usually it's low thyroid. And when you have hypothyroidism, which is low thyroid, very often, not always, cholesterol gets involved and cholesterol starts to go up. So we have a great podcast all about the thyroid with Dr. Amy Horniman, and where she explains all of this. Also, Dr. Carrie Jones had another episode on that where she explains that thyroid cholesterol connection. So if you have high cholesterol, certainly go and test your thyroid. It should be not only the TSH, thyroid stimulating hormone, it should be the reverse T3, free T4. You can go a little bit deeper on that. Check out the episodes that I have for the full list, but go take a deeper dive into your thyroid if you are concerned. Hypertension is just another way of saying high blood pressure, and that we have an increased risk of stroke and heart attack. Again, this is all due to the loss of our hormones. So why aren't we paying more attention to this, right? These are the silent killers. You need to, if you are asymptomatic, I highly encourage you to look at your blood lipid panel, your thyroid, and go get your bones tested one way or another. So that's kind of it. In conclusion, we have the 3 stages of perimenopause: the early perimenopause, middle, and the late. Menopause is a one-day event, right? It's 12 consecutive months without your period. After that, we're all going into post-menopause. And there's those 2 phases of menopause: early menopause and then early post-menopause and late post-menopause. 103 symptoms. Go check them out at weareamorphous.com. There are solutions to all of these symptoms. If you are experiencing one of them, some of them, all of them, intensely, frequently, or once in a while, you want to get rid of them. I always say your body's trying to speak to you with whatever it is that it's showing you. We have bioidentical hormone therapy. I am a big fan. Most women are candidates. If you do go down this path, please educate yourself on it. Go and listen to all the fabulous podcasts we have here on Hack My Age. And I also have recommended other podcast hosts. I have recommended reading. I have great resources, websites, all on hackmyage.com/freebies. You can get all of that information for free to get yourself educated on this. Please don't go to your doctor before reading a little bit more about it. There's supplements that we can take to help with these symptoms. Obviously, a change in your diet and lifestyle will help as well. May not eliminate all of them, but will help the transition as well as protect your future self, right? No smoking, quit, please. Drinking, lower your consumption. This is robbing your body of detoxing the hormones that you may still have left over or the ones that you are taking. Exercise, we gotta keep moving. There's so many things that we can do, and there's not just one size fits all. Just do whatever you can at this moment. Start somewhere. Stress is a trigger for are hot flashes for many of these symptoms that we're having. So manage the stress isn't going away. Make stress your friend. Have a different attitude about it, but learn it's not the stress itself, it's your reaction to the stressful event that really counts. Because when you react in a negative way, of course, your cortisol increases, and it's fine to have cortisol increase, but we don't want it lingering up high too long, right? So we need to manage our stress, whether it's through yoga or meditation or getting outside and walk in nature, spend time with friends who make you laugh. All these things change your perspective about menopause too. A lot of these things help manage the stress. And then don't ignore your sleep. Sleep optimization is so key. That doesn't mean you can't go out and have fun and have a drink on a Friday night, right? You can, that's part of your happiness routine. I'm not saying you have to give all these things. You can go to bed late once in a while, but if you find yourself night after night staying up till midnight, 1, 2 a.m., this is probably not going to support your menopause transition very well. It's probably going to exacerbate the menopause symptoms. And then don't forget your community, your women, your menopausal. Your friends are there to help you and support you. Please have the conversation about menopause with them. Open the dialogue. Make menopause a normal conversation. Normalize it, please. It's something we're all going to go through, no matter how healthy you are. We're all going to get through it. Maybe you can delay it. Maybe you can offset the symptoms. That's a wonderful thing. But eventually, we're all going to lose our hormones, and that's okay. Purpose also is really important. Your purpose in life. What are you doing now that kids are gone? Maybe you want to change jobs. Maybe you want to have a new career. It's a time of change and transformation. So consider that, make that part of your menopausal journey. And then don't forget vitamin J. It's vitamin joy, right? We need to have joy in life. I know it's hard if you're dealing with a lot of symptoms and they're very intense, but knowing that you have solutions is already half the battle. And then managing them and figuring out how to offset them through all our biohacks, all the things that we do, it's your choice. And that's going to make the transition so much easier. So remember, the menopause transition, the symptoms we have and we feel vary so much woman to woman. No two women have exactly the same experience or have the same, say, biomarkers when you look under the hood. Take menopause as your N of 1 experiment to make yourself a better person. We have a chance to improve our health, to improve our lives, to protect our future selves. Why not use this time now to do it? And of course, go and seek medical advice from a proper medical professional, right? Go and find the menopause doctor. I have, again, in my freebies, how to find a menopause doctor. There's so many out there. I know it feels like there are none, but there are, and they want to help you, and they're getting more and more experienced, more and more trained. So please don't hesitate to reach out to a doctor who is well-trained in menopause. If you need help with that, you just reach out. So thank you so much for getting this far with me. I hope it's inspired you. I hope it's opened up new information for you. Please share the episode with anyone you think who needs to hear it. And if you are able to rate and review on Apple Podcast or Spotify, please do. It's a little gesture that makes a huge impact for me. So thank you so much. Have a good night, good morning, good evening, wherever you are. And I will see you next time.